on another variable. Key features. Participants are randomly assigned to different groups to ensure that any differences observed are due to the manipulation and not other factors. Example: a researcher might study the effect of a new teaching method on student performance by randomly assigning one class to use the new method and another class to use the traditional method. Causal comparative ex post facto research. Definition: this design looks at existing differences between groups when random assignment is not possible. Researchers compare groups based on pre-existing characteristics. Key features. Researchers analyze data to find relationships between variables after the fact. Example: a study comparing the academic performance of students who attended public schools versus private schools without manipulating the school type. Correlational study. Definition: a correlational study examines the relationship between two variables to determine if they are associated but does not imply causation. Key features. Researchers collect data and look for patterns, but they do not manipulate variables. Example: a study might find a positive correlation between hours studied and test scores, meaning that as study hours increase, test scores tend to increase as well. Simple survey research. Definition: this involves collecting data through questionnaires or interviews to gather information about people's thoughts, feelings, or behaviors. Key features. Surveys can be conducted with large groups to gather a wide range of information. Example: a researcher may survey high school students about their attitudes toward school safety. Pre-experimental designs. Definition: pre-experimental designs are simpler designs that do not include random assignment. They often involve measuring a variable before and after an intervention. Key features. They lack the rigor of true experiments and may not provide strong evidence of cause and effect. Example: a researcher might measure student grades before and after implementing a new study program. Within subject design, related measures design. Definition: in this design, the same participants are exposed to all conditions of the experiment. Each participant serves as their own control. Key features. This design can reduce the impact of individual differences on the outcome. Example: a researcher might test the effectiveness of two different teaching methods by having the same group of students experience both methods in different sessions. Between groups design. Definition: in a between groups design, different participants are assigned to different groups, each receiving different treatments or conditions. Key features. This design helps compare the effects of different interventions on separate groups. Example: one group of students might use a traditional study method, while another group uses a new method, and their performances are compared. Time series design. Definition: a time series design involves repeated measurements over time to observe changes in a single group. Key features. This design can help identify trends or patterns in data. Example: a researcher might measure a community's crime rate over several years to see if it decreases after a new policing strategy is implemented. Solomon four-group design. Definition: this design combines both true experimental and pre-experimental designs to control for potential confounding variables. Key features. It includes 4 groups, 2 experimental groups, and 2 control groups, with one of each receiving a pre-test and the other not. Example: a study on a new educational program might have one group take the program with a pre-test, another take the program without a pre-test, a control group with a pre-test, and a control group without a pre-test. 2. Statistical concepts. Statistics are used to analyze data and draw conclusions. Here are some key statistical concepts. T-test. Definition: a t-test compares the means of 2 groups to determine if they are statistically different from each other. Key features. It helps to establish whether observed differences are likely due to chance. Significance level. Definition: the significance level indicates the probability of making a type 1 error, which occurs when a researcher incorrectly rejects the null hypothesis. Beta error. Definition: a type 2 error occurs when a researcher fails to reject the null hypothesis when there is a true effect. This means concluding that there is no difference when one actually exists. Correlation coefficient. Definition. The correlation coefficient measures the strength and direction of the relationship between two variables, ranging from -1 to +1. Key features. A positive value indicates a direct relationship, while a negative value indicates an inverse relationship. Coefficient of determination. Definition. R² measures the proportion of variance in one variable that can be explained by another variable. Coefficient of non-determination. Definition. This represents the proportion of variance in one variable that cannot be explained by another variable. Effect size. Definition. Effect size quantifies the magnitude of a treatment effect or the strength of a relationship, helping to understand the practical significance of results. Measures of central tendency. Mean, the average of set of numbers. Median, the middle value when numbers are arranged in order. Mode, the most frequently occurring value in a dataset. Normal curve, bell curve. Definition. The normal curve is a symmetrical, bell-shaped curve that represents the distribution of data around the mean, with most occurrences clustering around the central peak. Standard deviation. Definition. Standard deviation measures the amount of variation or dispersion in a set of values. A low standard deviation means values are close to the mean, while high standard deviation indicates a wide range of values. Percentiles. Definition. Percentiles indicate the relative standing of a value within a data set. For example, the 50th percentile is the median. Z-scores. Definition. A z-score indicates how many standard deviations a data point is from mean. A positive z-score means the value is above the mean, while a negative z-score means it is below the mean. T-scores. Definition. T-scores are standardized scores with a mean of 50 and a standard deviation of 10, used to compare scores across different distributions. Standing S. Definition. Standing S are a method of scaling test scores on a 9-point scale, where a score of 5 is average. Parametric statistics. Definition. Parametric statistics assume the data follows a normal distribution and often require random sampling. These methods include t-tests and ANOVA. Non-parametric statistics. Definition. Non-parametric statistics do not assume a specific distribution and are used for data that do not meet the assumptions of parametric tests. Meta-analysis, meta-research. Definition. Meta-analysis is a statistical technique that combines the results of multiple studies to arrive at a comprehensive conclusion about a specific research question. Cost-benefit analysis. Definition. CBA is a systematic approach to estimating the strengths and weaknesses of alternatives to determine the best option. Program evaluation. Definition. Program evaluation assesses the effectiveness and efficiency of a program, providing information to improve its implementation and outcomes. Statistical analysis. Definition. Statistical analysis involves collecting, reviewing, and interpreting data to identify patterns and draw conclusions. Data interpretation. Definition. Data interpretation refers to the process of making sense of collected data, analyzing it to understand the implications, and communicating the findings effectively. Conclusion. Understanding research methods and statistics is crucial for conducting and evaluating studies in psychology and other fields. By recognizing different research designs, statistical concepts, and data analysis techniques, researchers can draw meaningful conclusions and contribute to the body of knowledge in their areas of study. Mastery of these concepts is essential for any student preparing for the CPC exam and for future professional practice. 7. Group counseling and family dynamics. Family dynamics, family systems, family structure, family communication, family roles group, dynamics group, counseling children's career, counseling groups, adolescent career, counseling groups, theme groups, structured versus unstructured groups, curative factors, and groups, cost effectiveness of group counseling. Parenting typologies, blended families, intergenerational issues, triangulation coalitions, and alliances, marriage and family problems, divorce rates, remarriage statistics. Group counseling and family dynamics. Understanding group counseling and family dynamics is essential for counselors, as these concepts play a crucial role in how individuals interact within families and groups. This guide will break down each topic in simple terms, providing key concepts, important details, and examples to illustrate the ideas. 1. Family dynamics. Family dynamics refer to the patterns of interaction and relationships among family members. These dynamics influence how family members communicate, solve problems, and support each other. Key concepts. Interactions. How family members talk and behave with one another. Roles. The positions or responsibilities each family member takes on. Example. In a family where one parent takes on the role of the primary caregiver, while the other is the breadwinner, the dynamics might show that the caregiver manages daily routines and emotional support, while the breadwinner focuses on financial stability. 2. Family systems. The family systems theory suggests that a family functions as a complex system where each member affects and is affected by others. This means that changes in one part of the family can impact the entire system. Key concepts. Interconnectedness. Each family member's behavior influences others. Balance. Families strive to maintain stability, but disruptions can lead to conflicts. Example. If a teenager begins acting out in school, it might affect the parent's relationship, leading to increased stress at home. The family system must address the teenager's behavior and its impact on family dynamics. 3. Family structure. Family structure refers to the organization of a family, including the roles and relationships of family members. Structures can vary widely, including nuclear families, extended families, single-parent families, and blended families. Key concepts. Nuclear family, a family consisting of two parents and their children. Blended family, a family formed when one or both partners have children from previous relationships. Example. A blended family may consist of a mother with two children and a father with one child, creating a new family unit with varying dynamics. 4. Family communication. Family communication involves how family members exchange information, express feelings, and resolve conflicts. Effective communication is vital for healthy family relationships. Key concepts. Open communication, encouraging family members to share thoughts and feelings freely. Conflict resolution, strategies for addressing disagreements in a constructive manner. Example. A family that holds regular family meetings to discuss issues and share feelings promotes open communication, allowing members to express concerns and work together to find solutions. 5. Family roles. Family roles are the specific functions that each family member takes on within the family unit. Understanding these roles helps clarify how families operate. Key concepts. Caretaker, the person responsible for nurturing and caring for others. Peacemaker, a family member who tries to resolve conflicts and keep harmony. Example. In a family, the oldest sibling might take on the role of the caretaker, helping younger siblings with homework and emotional support, while a parent might act as the provider. 6. Group dynamics. Group dynamics refer to the social and psychological processes that occur within a group. These dynamics influence how group members interact, make decisions, and work together. Key concepts. Norms, the unwritten rules that govern behavior in a group. Roles in groups, similar to family roles, group members may take on specific roles. Example. In a therapy group, one member may naturally take on the role of the leader by guiding discussions, while another may serve as the supporter, encouraging others to share their thoughts. 7. Group counseling. Group counseling is a therapeutic approach where a small group of individuals meets with a trained counselor to discuss issues, share experiences, and support one another. Key concepts. Shared experiences. Members share similar challenges or goals. Supportive environment. Group members provide emotional support and feedback. Example. A group counseling session for individuals dealing with grief allows members to share their experiences and feelings, helping them feel less isolated and more understood. 8. Children's career counseling groups and adolescent career counseling groups. Children's career counseling groups and adolescent career counseling groups focus on helping younger individuals explore their interests, strengths, and potential career paths. Key concepts. Developmental appropriateness, tailoring discussions and activities to suit the age group. Skill building, helping participants develop skills related to career exploration. Example. A career counseling group for adolescents may include activities like personality assessments and discussions about various career options, helping them make informed decisions about their future. 9. Theme groups. Theme groups focus on specific topics or issues, allowing members to explore common interests or challenges. Key concepts. Focused discussions. Group sessions center around a particular theme, such as stress management or self-esteem. Shared learning. Participants learn from each other's experiences and insights. Example: a theme group on stress management might involve exercises, discussions, and sharing coping strategies among participants. 10. Structured versus unstructured groups. Structured groups have a specific agenda and planned activities, while unstructured groups are more open and flexible, allowing discussions to flow naturally. Key concepts. Structured groups typically involve set topics, activities, and goals. Unstructured groups focus on spontaneous discussions and member-led topics. Example: a structured group might follow a curriculum with specific exercises each week, while an unstructured group might start with an open discussion where members bring up topics they want to explore. 11. Curative factors in groups. Curative factors are the elements that contribute to the therapeutic benefits of group counseling. Two important factors are universality, the realization that others share similar experiences and feelings, helping members feel less isolated. Mutuality, the support and feedback provided by group members, which fosters connection and healing. Example: in a group for individuals with anxiety, members may express their fears and realize that others feel the same way, creating a sense of universality. Support from fellow members contributes to healing. 12. Cost-effectiveness of group counseling. Group counseling is often more cost-effective than individual therapy. It allows one counselor to work with multiple clients at once, making it a practical option for many people. Key concepts. Resource efficiency. Group sessions can be less expensive for clients and provide support to more individuals. Shared resources. Clients benefit from the collective experiences and insights of the group. Example: a community mental health center might offer group therapy sessions for a lower fee than individual counseling, making mental health support accessible to more people. 13. Parenting typologies. Diana Baumrind identified 3 main parenting styles, which influence children's development and behavior. Authoritative. Parents set clear expectations and rules, but also show warmth and support. This style tends to lead to well-adjusted children. Authoritarian. Parents enforce strict rules with little room for flexibility, often leading to children who may struggle with independence. Permissive. Parents are lenient and allow considerable freedom, which can result in children lacking self-discipline. Example: an authoritative parent might enforce a curfew but also explain the reasons behind it, while a permissive parent might allow their child to stay out late without any rules. 14. Blended families. Blended families are formed when one or both partners have children from previous relationships. These families can face unique challenges and dynamics. Key concepts. Adjustment. Family members must adapt to new roles and relationships. Communication. Open communication is essential for building trust and understanding. Example: in a blended family where one parent has a son and the other has a daughter, both children may need to adjust to sharing their home and developing a sibling relationship. 15. Intergenerational issues. Intergenerational issues refer to conflicts and dynamics that arise between different generations within a family. These can be influenced by cultural differences, values, and expectations. Key concepts. Cultural differences. Different generations may have varying beliefs and practices that can lead to misunderstandings. Value conflicts. Younger generations may challenge traditional values held by older family members. Example: a teenager might want to pursue a career in the arts, while their parents, who value traditional professions, may struggle to understand and support that choice. 16. Triangulation. Triangulation occurs when one family member involves a third person to mediate or influence a conflict between 2 other family members. This can complicate relationships and communication. Key concepts. Avoiding direct conflict. Triangulation often happens as a way to avoid addressing issues directly between the 2 original parties. Increased tension. Involving a third person can create additional tension and misunderstandings. Example: a child might tell one parent about a disagreement with the other parent, hoping to gain support and create tension between them rather than addressing the conflict directly. 17. Coalitions and alliances. Coalitions and alliances refer to the relationships formed between family members, often to support one another against others. Key concepts: coalition, a temporary alliance between family members against another member. Alliance, a more stable and ongoing relationship between two or more members. Example: if two siblings consistently team up against a third sibling in family discussions, they form a coalition that could lead to feelings of exclusion for the third sibling. 18. Marriage and family problems. Marriage and family problems can arise from various factors, including communication issues, financial stress, and different values. Key concepts: communication breakdown. Poor communication is often a significant factor in marital conflicts. Conflict resolution. Learning to address and resolve conflict constructively is crucial for healthy relationships. Example: a couple might struggle with communication about finances, leading to arguments and resentment. Counseling can help them learn effective communication strategies. 19. Divorce rates. Divorce rates reflect the number of divorces occurring in a given population within a specific time frame. Key concepts: impact on families. High divorce rates can affect children's emotional well-being and family dynamics. Changing norms. Cultural attitudes toward divorce can influence divorce rates. Example: in recent years, divorce rates have fluctuated, with younger generations often delaying marriage, which can lead to lower divorce rates in some demographics. 20. Remarriage statistics. Remarriage statistics provide insight into the prevalence of remarriage after divorce. Key concepts: blended families. Remarriage often leads to the formation of blended families, which can have unique dynamics. Adjustment challenges. Individuals may face challenges in adjusting to new relationships and family structures. Example: data might show that a significant percentage of divorced individuals remarry within a few years, leading to blended family scenarios where children from previous marriages must adapt to new family members. Conclusion: understanding group, counseling, and family dynamics is essential for effective counseling practice. By exploring concepts such as family dynamics, family systems, communication, group counseling, and the various issues that arise in family relationships, counselors can help individuals navigate their relationships and improve their overall mental health. This knowledge also prepares aspiring counselors for the challenges they may face in their professional careers. 8. Psychopathology and mental health conditions. General concepts of mental health: mental disorders, DSM-5, ICD-10, neurodevelopmental disorders, substance-related and addictive disorders, mood disorders, anxiety disorders, obsessive-compulsive and related disorders, trauma and stress-related disorders, feeding and eating disorders, dissociative disorders, somatic symptom and related disorders, paraphilic disorders, gender dysphoria, sleep-wake disorders, intellectual disability, bipolar disorder, suicidal ideation and behavior, addiction, bullying, cancer and mental health impact, alcoholism, suicide rates and methods. 9. Specific topics and keywords. Applied behavior analysis, bibliotherapy, cognitive restructuring, dream analysis, empathy, externalizing the problem family, sculpting genogram, humanistic tradition, hypochondriasis, intellectualization. Mindfulness. The personal is political, psychodynamic, psychometrician, psychoanalytic, rational self-counseling, savant tendencies, skeleton keys, symptom substitution, teleological approach. The personal is political, thought-stopping, trans-theoretical model, unconscious mind, V-codes, worldview generalizations. Specific topics and keywords in counseling. Understanding specific topics and keywords in counseling is crucial for effective practice and communication. This guide will explain various concepts, including applied behavior analysis, bibliotherapy, cognitive restructuring, and more, using simple language and examples. 1. Applied behavior analysis. Applied behavior analysis is a therapy based on the principles of behaviorism, which focuses on changing specific behaviors through reinforcement and consequences. It is commonly used with individuals with autism. Key concepts: behavior modification, changing behaviors by rewarding positive actions and discouraging negative ones. Reinforcement, providing a reward after a desired behavior to encourage that behavior in the future. Example: if a child learns to say thank you and receives praise or a small treat, they are more likely to say thank you in the future. 2. Bibliotherapy. Bibliotherapy uses books and literature to help individuals deal with emotional and psychological issues. It allows readers to explore feelings and situations through characters and stories. Key concepts: self-reflection. Reading can help individuals reflect on their experiences and feelings. Empathy development. Literature can foster understanding of others' experiences. Example: a counselor might recommend a book about overcoming grief to a client who has lost a loved one to help them process their emotions. 3. Cognitive restructuring. Cognitive restructuring is a technique used in cognitive behavioral therapy to change negative thought patterns into more positive and realistic ones. Key concepts: identifying negative thoughts, recognizing harmful beliefs that contribute to emotional distress, challenging and replacing thoughts, learning to question and substitute negative thoughts with positive ones. Example: if someone thinks, "I will never succeed," cognitive restructuring would guide them to reframe that to, "I have succeeded before and can learn from my mistakes." 4. Dream analysis. Dream analysis is a therapeutic technique used to interpret the meanings of dreams. It is often associated with psychoanalysis. Key concepts: symbolism. Dreams may contain symbols that reflect deeper emotions or conflicts. Exploring the unconscious. Analyzing dreams can reveal hidden thoughts and feelings. Example: a client who dreams about flying might be encouraged to explore feelings of freedom or escape from their daily life. 5. Empathy. Empathy is the ability to understand and share the feelings of others. It is essential in counseling to build trust and rapport. Key concepts: active listening, fully focusing on and understanding what a client is saying. Emotional validation, acknowledging and affirming a person's feelings. Example: if a client is upset about a breakup, an empathetic counselor might say, "It's understandable to feel hurt and sad after losing someone you care about." 6. Externalizing the problem. Externalizing the problem involves separating a person's identity from their issues. It helps individuals see that they are not defined by their problems. Key concepts: distancing, viewing the problem as something external rather than an intrinsic part of oneself. Empowerment, encouraging clients to take control of their lives by addressing the problem. Example: rather than saying, "I am an anxious person," a client might say, "I am experiencing anxiety," which helps them recognize that they can manage it. 7. Family sculpting. Family sculpting is a therapeutic technique that visually represents family dynamics and relationships. It involves using physical space and body positioning to illustrate how family members interact. Key concepts: visualization, creating a physical representation of family relationships. Understanding dynamics, helping clients see patterns in their family interactions. Example: a therapist might ask family members to stand in different positions to represent their feelings toward each other, allowing them to discuss those feelings openly. 8. Genogram. A genogram is a graphic representation of a family tree that includes information about family relationships, patterns, and significant events. Key concepts: family history, mapping out family relationships and history. Patterns and dynamics, identifying patterns of behavior or issues that may affect current family members. Example: a genogram can show how mental health issues or substance abuse have affected multiple generations in a family. Knowing to a humanistic tradition. The humanistic tradition in psychology emphasizes personal growth, self-actualization, and the importance of individual experiences. Key concepts: client-centered therapy, a therapeutic approach that focuses on the client's perspective and encourages self-exploration. Holistic approach, considering the whole person, including emotions, thoughts, and experiences. Example: A humanistic therapist may create a safe space for clients to explore their feelings and encourage them to pursue their personal goals. 10. Hypochondriasis. Hypochondriasis involves excessive worry about having a serious illness, despite little or no medical evidence. Key concepts: health anxiety, constantly fearing that one has a serious health condition. Impact on life. This worry can lead to significant distress and affect daily functioning. Example: a person may frequently visit doctors for minor symptoms, convinced they have a severe illness despite medical reassurance. 11. Intellectualization. Intellectualization is a defense mechanism where a person focuses on the intellectual aspects of a situation while ignoring emotional responses. Key concepts: avoiding emotions, using logic and reasoning to avoid confronting feelings. Coping strategy. While it can provide temporary relief, it may hinder emotional processing. Example: someone facing a serious illness might focus on reading medical books about their condition instead of addressing their fear and anxiety about the diagnosis. 12. Mindfulness. Mindfulness is the practice of being present in the moment and fully aware of one's thoughts, feelings, and surroundings without judgment. Key concepts: awareness, paying attention to the present moment. Non-judgment, accepting thoughts and feelings without labeling them as good or bad. Example: practicing mindfulness might involve focusing on your breath while sitting quietly, noticing any thoughts that come up without reacting to them. 13. The personal is political. This phrase reflects the idea that personal experiences, especially those related to identity and oppression, are connected to larger social and political issues. Key concepts: social context, recognizing how personal struggles are influenced by societal factors. Empowerment, understanding that individual experiences can contribute to collective action for change. Example: a person experiencing discrimination may realize that their personal feelings of frustration are part of a larger societal issue that needs to be addressed. 14. Psychodynamic. Psychodynamic therapy focuses on the unconscious mind and how it influences thoughts and behaviors. It often explores childhood experiences and their impact on current behavior. Key concepts: unconscious processes, understanding how hidden thoughts and feelings affect behavior. Transference, the phenomenon where clients project feelings about important figures from their past onto the therapist. Example: a client might discuss childhood experiences that contribute to their current relationship struggles, helping them gain insight into their behavior. 15. Psychometrician. A psychometrician is a professional who specializes in designing and interpreting psychological tests and assessments. Key concepts: testing and measurement, creating reliable and valid assessments to measure psychological constructs. Data analysis, analyzing test results to provide insights about individuals. Example: a psychometrician might develop a new personality test to help counselors better understand their clients' traits and preferences. 16. Psychoanalytic. Psychoanalytic therapy is based on the theories of Sigmund Freud and focuses on exploring the unconscious mind and unresolved conflicts. Key concepts: free association, encouraging clients to speak freely to uncover hidden thoughts and feelings. Dream interpretation, analyzing dreams to gain insight into the unconscious. Example: during therapy, a client may discuss their dreams, and the therapist helps them uncover underlying fears or desires related to those dreams. 17. Rational self-counseling. Rational self-counseling is a technique where individuals use rational thinking to understand and manage their emotions and behaviors. Key concepts: self-reflection, analyzing one's thoughts and feelings to identify irrational beliefs. Problem-solving, using logical reasoning to address personal challenges. Example: a person might write down negative thoughts and then challenge them with rational responses, helping them gain perspective on their situation. 18. Savant tendencies. Savant tendencies refer to exceptional abilities in a specific area, often seen in individuals with developmental disorders, especially autism. Key concepts: exceptional skills. Individuals may have remarkable talents in areas such as music, art, or mathematics. Diverse presentation. Savant abilities can vary widely among individuals. Example: a child with autism may have a remarkable memory for dates or can play a complex piece of music after hearing it just once. 19. Skeleton keys. Skeleton keys refer to broad, flexible strategies or concepts that can unlock understanding in various situations. Key concepts. Versatile tools. These keys can be applied to different contexts to facilitate understanding or problem solving. Adaptability. They allow for adjustment based on specific circumstances. Example: a counselor might use mindfulness techniques as a skeleton key to help clients manage anxiety in various situations, whether at work or in social settings. 20. Symptom substitution. Symptom substitution occurs when a person resolves one issue or symptom, only to have another related symptom emerge. Key concepts. Underlying issues. This often suggests that the root cause of the problem has not been addressed. Cycle of symptoms. New symptoms may appear if the original issue is not fully resolved. Example: if someone uses alcohol to cope with anxiety and then stops drinking, they might develop a new symptom, like depression, if they haven't dealt with the underlying anxiety. 21. Teleological approach. The teleological approach in psychology focuses on understanding behavior based on the goals or purposes behind actions. Key concepts. Goal-oriented. Emphasizes understanding actions by looking at the desired outcomes. Motivation. Considers what individuals are trying to achieve through their behaviors. Example: a person might engage in volunteering because they want to feel more connected to their community and find purpose in their life. 22. Unconscious mind. The unconscious mind refers to the part of the mind that contains thoughts, memories, and desires that are not currently in conscious awareness, but still influence behavior. Key concepts. Hidden influences. The unconscious can affect feelings and actions without individuals realizing it. Psychoanalytic focus. Many therapeutic approaches explore the unconscious to uncover hidden conflicts. Example: a person may have an unconscious fear of failure that affects their willingness to take risks, even if they consciously believe they can succeed. 23 V-codes. V-codes are used in the DSM-5 to indicate situations that may be a focus for clinical attention but are not considered mental disorders. They help highlight issues affecting mental health. Key concepts. Non-diagnostic codes. These codes are used to describe life circumstances or issues that may impact mental health without being classified as disorders. Clinical relevance. They provide context for understanding a person's mental health situation. Example: a V-code might be used for someone experiencing stress due to a recent divorce, indicating that this situation is relevant to their mental health but is not a diagnosis. 24. Worldview generalizations. Worldview generalizations refer to broad beliefs or assumptions that individuals hold about themselves, others, and the world based on their experiences and culture. Key concepts. Influence on behavior. These generalizations shape how people interpret experiences and interact with others. Cultural context. Worldviews are often influenced by cultural background and personal experiences. Example: a person who believes that people are inherently trustworthy may approach relationships with openness, while someone who has experienced betrayal may be more guarded and suspicious. Conclusion. Understanding these specific topics and keywords is essential for effective counseling practice. Concepts like applied behavior analysis, bibliotherapy, cognitive restructuring, and others provide valuable tools for counselors to help individuals navigate their mental health challenges. By grasping these ideas, aspiring counselors can enhance their skills and better support their clients on their journey toward healing and growth.